Hi, I'm Dr. Karen McKenzie in the psychology department, and today we're going to be talking about healthy relationships. We're going to be talking about romantic relationships in particular. And if you poll Americans and you say what is most critical for your happiness, the most common response is relationships. And then if you poll people and you say what causes the most pain in your life, the most common response is relationships. So relationships can do wonderful things for us and greatly increase our life satisfaction, but if we make bad decisions, unhealthy decisions in our romantic relationships, then they can cause the most pain. So hopefully in the next 20 minutes you'll get a sense of sort of some of the most important characteristics and criteria for having a good, healthy, solid, stable, supportive romantic relationship. And I wanted to start with a quote, and I don't know if you would recognize this woman or not, but her name is Gloria Estefan, and by most people's standards, she would be considered successful. She's a wonderful songwriter, she's a musician, she's very talented, she's beautiful, she's very famous, she's extremely wealthy. So I always think it's interesting that she says real success is having love in your life. And so that's what we're going to talk about. I'm going to tell you about some of the research that looks at exactly this question and how you can be successful in your romantic relationships. So first I want to talk about some of the benefits. Why does it matter? Well, it matters because when they do studies where they have two separate groups who are pretty similar to one another in terms of age or income, other demographic variables, the only thing that is different between the two groups is that one of the groups, they're all involved in healthy, stable, supportive relationships, and the other group not involved in a good relationship or not involved in a relationship at all. And they look to see if there are differences between the two groups, and there are. They get a lot of significant differences, and these are just some of the differences that they get. It includes things like health. Those who are in the healthy relationships, they have better health. You're less likely to get sick if you're involved in a good relationship. And this is true for minor things like catching a cold or getting the flu, to more major things that require hospitalization. And if you have two people who have a similar diagnosis in the hospital, one is involved in a relationship, the other isn't, the person who's involved in the healthy relationship, they recover quickly and they are released earlier. So that is a significant difference. Longevity, what does that mean? Longevity means just how long you live. Other things being equal, those who have good relationships in their life, they simply live longer than other people. Depression rates, loneliness rates are significantly lower for people who have good relationships compared to others. Alcoholism rates, drug use, illegal substance abuse, eating disorders, particularly amongst college-aged women, which is a very vulnerable group for eating disorders and eating issues. And then even the prevalence of certain psychological disorders. One may have a genetic predisposition for a certain disorder, and the kinds of relationships they have might make the difference in terms of whether they actually develop that disorder or whether they do not. So there are many more different areas. These are just some that I chose to show you how much good relationships, how much of an effect they can have in terms of our lives. And you can take a moment and look at, here's some famous couples. I know we don't really know any of these couples, but we've probably read enough headlines or seen enough stories online to think we have some kind of sense about who they are and what may be some strengths in their lives or maybe some not so great weaknesses in their lives that have caused them to initially be attracted to each other, to stay together for some amount of time, and then in the majority of cases to eventually break up. And what do you think some of those characteristics are? You know, if you had to create a list of the criteria for what makes a great relationship, what would you put on that list? One thing that's important to keep in mind is how long a couple has dated before they get married or before they make some kind of long-term commitment to one another. And research shows that there's a certain amount of time that is sort of a cutoff in terms of the likelihood of staying together for the long term. With married couples, they look at how likely it is that they'll get divorced. And what might you guess? How long do you think a couple should date before they get married or make a long-term commitment? And the answer is 2 years. So research shows that if you date at least 2 years, then you're less likely to get divorced than couples who date less than that. And you have to be dating them for the 2 years. You don't get credit if you were friends with them. So if you take a class with somebody this semester and you start dating next semester, you get no partial credit for being friends with them this semester, because the way we interact with people when we're friends with them is very different from how we interact with them and what we expect from them when we are actually dating them. So keep that in mind. 2 years is the minimum amount of time that you would want to date someone before you marry them. So now we're going to talk about some of these predictors, and if you're in a relationship, or if you've been in a relationship in the past, or if you're considering a relationship in the future, these are some things that you can just keep in mind. You can ask yourself, are these things present or are they not? And we talked in our friendship section, we talked about the importance of similarity, and you can look at love relationships and you see the exact same effect. So similarity, a huge predictor of long-term happiness in romantic relationships. So opposites seem to attract only in the movies and in the comic strips. The next one is commitment and trust. And if you are committed to your partner, then your partner knows that they can trust you, that you're not going to cheat on them, that you're not even going to flirt with another person, that they don't have to check up on you. They can just feel completely relaxed and completely calm about that they'll always be there for you, and that they will always look out for you, and that they will always keep your best interests at heart. And so it just makes that other person be able to enjoy that relationship more, as opposed to constantly worrying. Are they really committed? Are they looking at that other person? Are they flirting with that person? Should I be jealous of this situation? And so on. So that's a big predictor as well. The third one is the one that I always think is a bit unfair, because you don't really have any control over it, but it does have an effect, and that's role models. And usually they're looking at whether your parents or whoever your adult role models were when you were growing up, what was their relationship like? Because what happens is when we're young, whatever happens in our household and our family, that's what we think is normal. And we often internalize those behaviors or attitudes that we see, and then when we become older, then that's what we do when we're engaged in a relationship, or when we're involved in a dispute or a conflict with another person. So if your parents were great role models and they had good conflict resolution skills, then you probably are modeling and imitating and doing exactly what they did. However, if the adult role models in your life weren't so great at conflict resolution or relationships in general, then it's possible that that might be your approach to relationships as well. If there was a lot of screaming or emotional abuse or slamming doors or walking off or the silent treatment, then that may be what you grow up thinking is the correct and appropriate way to relate to another person. And the good news is it's not doomed to fail. Just because you were exposed to that doesn't mean it's inevitable that you will do that, but it might be your typical initial response. And so you just have to work harder to overcome it and learn more appropriate, healthy ways to communicate with a partner. The fourth one is low stress. And I know that college is very stressful, especially that first semester, freshman year. And there's, in some ways, stress is inevitable. You can't really get rid of it, but there's certainly things that you can do in order to try to reduce stress in your life. And I'm not talking about stress within your relationship. I'm talking about external stress, other stress that you have. And so what studies show is that we don't really compartmentalize our life. We don't keep everything separate, but rather if we're experiencing stress in one area, it's going to spill over and it's going to affect our stress level in other areas. So for the sake of your romantic relationship, if you have a lot of financial problems, if you cannot get along with somebody in your family, if you work and you are miserable at your part-time job, then again, for the sake of your relationship, do something to work out that stress and that other conflict, because it is going to negatively affect your relationship, even if you don't want it to.